Have you ever wondered why vitamin B12 is so important for your body? In today's video, we'll explore 15 symptoms of vitamin B12 deficiency that you need to watch out for. Vitamin B12 is essential for creating DNA and red blood cells. However, it doesn't stay in your system for long, nor does your body produce it naturally. This can lead to a vitamin B12 deficiency, which manifests in various ways, such as pale skin, fatigue, and glossitis. Vitamin B12 plays a critical role in keeping your brain and nerves healthy and ensuring the proper formation of red blood cells. Without it, your body can't function optimally, leading to a range of health issues. Stick around until the end, where we'll share tips on how to boost your vitamin B12 levels through certain foods. From increased heart rate to mood swings, understanding these symptoms can help you catch a deficiency early and take action to improve your health. Let's get started on our list of the 15 symptoms of vitamin B12 deficiency and learn how to keep our bodies well-nourished and thriving. Number 15. Easy bruising. One noticeable sign of vitamin B12 deficiency is easy bruising. When your body lacks sufficient vitamin B12, it struggles to produce adequate red blood cells, which are crucial for blood clotting. Red blood cells carry oxygen throughout your body and help repair damaged blood vessels. Without enough of these cells, your blood vessels are more prone to breaking, leading to bruises even from minor bumps or injuries. Scientific research supports this connection. A study published in Blood in 2002 found that vitamin B12 deficiency can impair the body's ability to form blood cells, which can disrupt the clotting process. This disruption makes it harder for your body to heal and recover from injuries, resulting in more frequent bruising. It's important to note that easy bruising can also occur due to deficiencies in other nutrients, such as calcium or vitamin C. Calcium helps strengthen blood vessels, and vitamin C is vital for the synthesis of collagen, which supports blood vessel walls. To determine whether your bruising is related to a vitamin B12 deficiency, a simple blood test can measure your B12 levels. This test will provide a clear indication of whether you need to address a deficiency and seek appropriate treatment or dietary adjustments. Number 14. Increased heart rate. One of the early signs of vitamin B12 deficiency is an increased heart rate. This occurs because vitamin B12 plays a crucial role in the production of red blood cells, which are essential for transporting oxygen throughout your body. When you're deficient in vitamin B12, your body produces fewer red blood cells, leading to a condition known as anemia. Anemia reduces the amount of oxygen available to your tissues and organs. In response, your heart has to work harder to ensure that enough oxygen reaches vital organs such as the brain, liver, and muscles. This compensatory mechanism results in an increased heart rate, as your heart beats faster to pump more blood and deliver adequate oxygen where it's needed. Scientific evidence supports this phenomenon. Research published in the Journal of the American College of Cardiology highlights that anemia, including that caused by vitamin B12 deficiency, is associated with an increased heart rate and elevated cardiac output. The heart's increased workload is an attempt to maintain normal oxygen levels in the body despite the reduced capacity of the blood to carry oxygen. Addressing vitamin B12 deficiency through dietary changes or supplements can help normalize red blood cell production and reduce the strain on your heart. Number 13. Glossitis. Glossitis is a condition characterized by inflammation and soreness of the tongue. If you have glossitis, you might experience a burning sensation in your mouth, and your tongue may appear smooth and glossy, often with a loss of taste buds. The tongue can also become red, swollen, and painful. Scientific research has shown a clear link between glossitis and vitamin B12 deficiency. A study published in the American Journal of Clinical Nutrition found that deficiencies in vitamin B12 can lead to changes in the tongue's appearance and function. This deficiency impairs the production of healthy red blood cells and affects the integrity of mucous membranes, including those in the mouth. In addition to glossitis, individuals with vitamin B12 deficiency may experience other oral symptoms such as inflamed or swollen tongues and mouth ulcers. These symptoms arise because vitamin B12 is essential for the maintenance and repair of mucosal tissues. A deficiency in this vitamin can lead to a reduced ability to regenerate these tissues, resulting in painful and inflamed areas in the mouth. Addressing vitamin B12 deficiency through dietary changes or supplements can help alleviate these symptoms and restore normal function and appearance to the tongue. If you experience persistent glossitis or other oral issues, it's important to consult with a healthcare provider for appropriate diagnosis and treatment. Number 12. Pale skin. Pale skin can be an indication of several underlying health issues, and one such cause could be a deficiency in vitamin B12. While pale skin is commonly linked to jaundice, which involves a yellowing of the skin due to liver dysfunction, it can also result from insufficient levels of vitamin B12. Vitamin B12 is essential for the production of red blood cells, which are crucial for transporting oxygen throughout the body. When you have a vitamin B12 deficiency, your body is unable to produce an adequate number of red blood cells, leading to a condition called anemia. Anemia reduces the oxygen carrying capacity of the blood, causing a decrease in the amount of oxygen delivered to tissues and organs. The diminished oxygen delivery to the skin can manifest as paleness, as the blood flowing to the skin lacks the normal red hue associated with well-oxygenated blood. Research published in the British Journal of Hematology highlights that vitamin B12 deficiency impairs red blood cell production and affects the distribution of oxygen in the body, contributing to the pallor observed in affected individuals. If you notice persistent pale skin alongside other symptoms of vitamin B12 deficiency, such as fatigue or glossitis, it's important to seek medical advice. A healthcare provider can perform blood tests to determine your vitamin B12 levels and recommend appropriate treatment to address the deficiency and improve your overall health. Number 11. Fatigue. Fatigue is a common and debilitating symptom of vitamin B12 deficiency, and understanding its connection to this nutrient is crucial for addressing this issue. Vitamin B12 plays an essential role in the production of red blood cells, which are responsible for transporting oxygen throughout the body. When vitamin B12 levels are inadequate, the body struggles to produce sufficient red blood cells, leading to a condition known as anemia. Anemia reduces the number of red blood cells available to carry oxygen to tissues and organs. As a result, the body's tissues, including the muscles and brain, receive less oxygen, which impairs their function and leads to feelings of extreme tiredness and weakness. This connection is supported by scientific research. For instance, a study published in the New England Journal of Medicine found that vitamin B12 deficiency significantly impairs the production of red blood cells, leading to reduced oxygen delivery and increased fatigue. Correcting a vitamin B12 deficiency can alleviate fatigue by improving red blood cell production and restoring normal oxygen levels in the blood. Supplementation with vitamin B12 or increasing dietary intake of B12-rich foods helps boost red blood cell count and enhances overall energy levels, as confirmed by research in the Journal of Clinical Nutrition. This can lead to improved vitality and reduced feelings of exhaustion, allowing individuals to regain their energy and well-being. Number 10. Blurred vision. Blurred vision can be a significant and distressing symptom of vitamin B12 deficiency. Vitamin B12 is essential for maintaining the health of the optic nerves, which are responsible for transmitting visual information from the eyes to the brain. When vitamin B12 levels are low, it can lead to a condition known as optic neuropathy, where the optic nerves become damaged. This damage impairs visual function, resulting in symptoms such as blurred vision. Scientific studies support this link between vitamin B12 deficiency and vision problems. Research published in the Journal of Neuro-Ophthalmology has demonstrated that low vitamin B12 levels can lead to optic nerve damage, contributing to visual disturbances. Another study in the American Journal of Clinical Nutrition found that correcting vitamin B12 deficiency can help reverse these visual symptoms, as the optic nerves recover once adequate B12 levels are restored. The good news is that blurred vision resulting from vitamin B12 deficiency is often reversible with proper treatment. To address the deficiency, individuals can take vitamin B12 supplements or increase their intake of B12-rich foods. Foods such as clams, sardines, beans, and eggs are excellent sources of vitamin B12 and can help restore optimal levels. Regular eye exams and blood tests to monitor vitamin B12 levels are recommended for anyone experiencing visual changes to ensure timely treatment and prevent long-term damage. Number 9. Distorted hand-eye coordination and balance. Vitamin B12 deficiency can impact more than just vision. It can also severely affect your nervous system, leading to problems with hand-eye coordination and balance. This occurs because vitamin B12 is crucial for the proper functioning of the nervous system. A deficiency can result in nerve damage, which disrupts the transmission of signals between the brain and various parts of the body. Research has shown that vitamin B12 deficiency can lead to neurological symptoms, including impaired coordination and balance. According to a study published in Neurology, B12 deficiency can cause peripheral neuropathy, where nerve damage affects motor and sensory functions. This damage can interfere with the brain's ability to process sensory information and coordinate physical movements effectively. Another study in the British Journal of Clinical Pharmacology highlights that deficiencies in B12 can lead to problems with proprioception, the sense of body position in space, which is essential for maintaining balance and coordination. Although distorted hand-eye coordination and balance are less common symptoms of vitamin B12 deficiency, they can occur. The reversibility of these symptoms largely depends on the extent of nerve damage and the timely initiation of treatment. While some individuals may experience improvement with B12 supplementation and dietary changes, conclusive evidence regarding the full reversibility of these symptoms remains limited. Regular monitoring and early intervention are crucial to managing these symptoms effectively. Number 8. Temperature regulation. The hypothalamus, a critical region in the brain, plays a pivotal role in regulating the body's homeostasis, which includes maintaining a stable internal environment. This brain region is responsible for managing various physiological processes, including temperature regulation, hormonal balance, and the nervous system's responses. One of its functions is to elevate body temperature as a response to infections or other stressors, as part of the body's defense mechanism. When there is a deficiency in vitamin B12, the hypothalamus may react by raising the body's temperature, similar to how it responds to an infection. This response is part of the body's attempt to cope with the stress caused by the deficiency, although it is not typically accompanied by the usual symptoms of fever such as chills or sweating. Scientific studies on this specific response are limited, and the exact mechanisms by which vitamin B12 deficiency triggers changes in body temperature regulation are not fully understood. However, research has shown that vitamin B12 is essential for maintaining normal brain and nerve function. A study published in Neuropsychology Review indicates that deficiencies in B12 can affect the central nervous system and potentially influence the hypothalamus's regulatory functions. While the elevation in body temperature due to B12 deficiency may not be as apparent as other fever symptoms, it underscores the need for further research to understand how vitamin B12 impacts temperature regulation and overall physiological balance. If you experience unexplained changes in body temperature along with other symptoms of B12 deficiency, it is advisable to consult a healthcare professional for appropriate evaluation and treatment. Number 7. Tingling sensation. A tingling sensation, often described as pins and needles, can be a telling sign of vitamin B12 deficiency. This sensation occurs because vitamin B12 is essential for the proper functioning of the nervous system. When vitamin B12 levels are insufficient, it can lead to nerve damage, which manifests as abnormal sensations such as tingling, especially in the hands and feet. Vitamin B12 plays a crucial role in maintaining the health of nerve cells and supporting the production of myelin, the protective sheath surrounding nerves. Without adequate B12, the myelin sheath deteriorates, impairing nerve signal transmission and leading to neurological symptoms. According to a study published in the Journal of Neurology, Neurosurgery and Psychiatry, vitamin B12 deficiency can cause peripheral neuropathy, which includes symptoms such as tingling, numbness, and weakness in the extremities. For individuals who follow a vegan diet, which may lack sufficient vitamin B12, incorporating fortified foods or supplements is crucial. Almond-based milk and other fortified plant-based products can provide an essential source of vitamin B12. Research in nutrients highlights that supplementation or consuming fortified foods is an effective way to prevent or address B12 deficiency in those who do not consume animal products. If you experience persistent tingling sensations or other signs of vitamin B12 deficiency, it is important to seek medical advice. A healthcare provider can conduct appropriate tests to diagnose the deficiency and recommend effective treatment options, including dietary adjustments or supplements. Number 6. Breathlessness. Breathlessness, or the feeling of not getting enough air, can be a symptom of vitamin B12 deficiency, particularly when it leads to anemia. Vitamin B12 is essential for the production of red blood cells, which are responsible for transporting oxygen throughout the body. When there is a deficiency of vitamin B12, the body produces fewer red blood cells, leading to a condition called megaloblastic anemia. This form of anemia impairs the oxygen-carrying capacity of the blood, resulting in reduced oxygen delivery to tissues and organs, which can manifest as breathlessness. A study published in Hematologica demonstrates that vitamin B12 deficiency-induced anemia often presents with symptoms such as shortness of breath, fatigue, and dizziness due to the lack of sufficient oxygen in the blood. While breathlessness from vitamin B12 deficiency is less common compared to other causes, it is a potential symptom that should not be overlooked. Fortunately, breathlessness caused by vitamin B12 deficiency is typically reversible with appropriate treatment. Supplementing with vitamin B12 can restore normal red blood cell production and improve oxygen transport, thereby alleviating breathlessness. In addition to taking supplements, incorporating breathing exercises can further enhance lung function and overall respiratory health. Regular follow-ups with a healthcare provider to monitor vitamin B12 levels and adjust treatment as necessary can help manage and resolve symptoms effectively. Number 5. Irritation. Irritation and mood disturbances can be linked to vitamin B12 deficiency, largely due to the vitamin's role in managing levels of homocysteine, an amino acid found in the brain. Vitamin B12 is crucial for breaking down homocysteine into beneficial compounds. When vitamin B12 levels are inadequate, the breakdown process is impaired, leading to elevated homocysteine levels in the brain. Elevated homocysteine has been associated with a range of mental health issues. Research published in Neuropsychology Review indicates that high homocysteine levels can negatively affect brain function and contribute to symptoms such as irritability, mood swings, and cognitive disturbances. This is because excess homocysteine can interfere with neurotransmitter function and damage brain cells, potentially leading to mental health problems. A study in the Journal of Clinical Psychiatry found a correlation between vitamin B12 deficiency, increased homocysteine levels, and psychiatric symptoms. While more research is needed to fully understand the relationship between homocysteine and mood disorders, current evidence supports the idea that correcting vitamin B12 deficiency can help manage irritability and other related symptoms. Addressing vitamin B12 deficiency through supplementation or dietary adjustments can help lower homocysteine levels and improve mental health outcomes. Consulting with a healthcare provider for a proper diagnosis and treatment plan is crucial if you experience persistent irritability or mood disturbances. Number 4. Stomach problems. Vitamin B12 deficiency can have significant repercussions for gastrointestinal health. A lack of this essential vitamin impairs the production of red blood cells, which are crucial for delivering oxygen to various organs, including the stomach. When vitamin B12 levels are insufficient, the resulting anemia reduces the oxygen supply to the stomach and other digestive organs. This decreased oxygenation disrupts the normal biochemical processes necessary for digestion. According to research published in the American Journal of Clinical Nutrition, vitamin B12 deficiency can lead to gastrointestinal symptoms such as nausea and diarrhea. This occurs because the stomach lining and intestines rely on adequate oxygen and nutrient levels to maintain their functions. Without sufficient oxygen, the digestive system's ability to process food and absorb nutrients is compromised, leading to digestive discomfort. Additionally, a study in gastroenterology highlights that vitamin B12 deficiency can cause changes in gut microbiota and impair the digestive tract's overall function. This can contribute to symptoms such as chronic nausea, diarrhea, and malabsorption of nutrients. Addressing vitamin B12 deficiency through supplementation or dietary changes can help restore normal oxygen levels and support proper digestive function. If you experience persistent stomach problems or other related symptoms, consulting with a healthcare provider is essential to determine the underlying cause and appropriate treatment. Number 3. Weight loss. Unintended weight loss can be a troubling symptom of vitamin B12 deficiency, and it often results from a combination of factors linked to this nutritional shortfall. Vitamin B12 is crucial for the production of red blood cells and the maintenance of healthy gastrointestinal function. When vitamin B12 levels are low, the body produces fewer red blood cells, leading to anemia. This condition impairs the body's ability to transport oxygen effectively, which can reduce overall energy levels and affect appetite. Research published in the Journal of Clinical Endocrinology and Metabolism highlights that anemia from vitamin B12 deficiency can lead to fatigue and decreased appetite. As a result, individuals may experience a reduced interest in eating, which contributes to weight loss. Additionally, vitamin B12 deficiency can disrupt normal digestive processes, leading to gastrointestinal issues such as nausea and diarrhea. These digestive problems further reduce food intake and contribute to weight loss. A study in Nutrition Reviews explains that chronic vitamin B12 deficiency can lead to significant weight loss due to both decreased appetite and malabsorption of nutrients. As the body struggles to maintain normal physiological functions with insufficient B12, weight loss becomes a visible consequence. Addressing vitamin B12 deficiency through supplementation or dietary adjustments is essential for reversing weight loss and restoring a healthy appetite. If you are experiencing unexplained weight loss along with other symptoms of B12 deficiency, consulting a healthcare provider is crucial for diagnosis and appropriate treatment. Number 2. Irrationality and cognitive impairment. Irrationality and cognitive impairment can be significant consequences of vitamin B12 deficiency, primarily due to the vitamin's critical role in maintaining proper brain function. Vitamin B12 is essential for the production of red blood cells, which are responsible for delivering oxygen throughout the body, including to the brain. When vitamin B12 levels are insufficient, the body produces fewer red blood cells, leading to reduced oxygen supply to the brain. Scientific studies have demonstrated a strong connection between vitamin B12 deficiency and cognitive decline. Research published in the Journal of Alzheimer's Disease shows that low levels of vitamin B12 can impair brain function, leading to symptoms such as difficulty thinking clearly, reasoning problems, and memory loss. The reduced oxygen delivery to the brain due to anemia exacerbates these cognitive issues, as the brain relies on a steady oxygen supply for optimal functioning. Furthermore, a study in neurobiology of aging highlights that chronic vitamin B12 deficiency is associated with accelerated cognitive decline and an increased risk of neurodegenerative disorders. The brain's diminished ability to perform complex cognitive tasks and reason effectively is often observed in individuals with prolonged B12 deficiency. Addressing vitamin B12 deficiency through supplementation or dietary changes can help restore normal red blood cell production and improve cognitive function. If you experience symptoms such as irrationality or memory loss, it is important to consult a healthcare provider for an evaluation and appropriate treatment to prevent further cognitive decline. Number 1. Mood swings. Mood swings can result from a variety of underlying factors, including vitamin B12 deficiency. Vitamin B12 is crucial for the proper functioning of the nervous system and the production of neurotransmitters that regulate mood. When vitamin B12 levels are low, it can disrupt the balance of these neurotransmitters, leading to emotional instability and mood swings. Research published in the American Journal of Psychiatry has identified a correlation between low vitamin B12 levels and mood disturbances such as irritability, depression, and anxiety. This is because vitamin B12 plays a vital role in synthesizing serotonin and dopamine, neurotransmitters that are essential for mood regulation. A deficiency in B12 can lead to imbalances in these chemicals, which may manifest as mood swings. Furthermore, a study in neuropsychopharmacology indicates that correcting vitamin B12 deficiency can help stabilize mood and improve overall mental health. By restoring adequate levels of this vitamin, the body can achieve better homeostasis, thus supporting emotional and psychological balance. It is important to note that mood swings can also be caused by other factors, including depression, hormonal imbalances, and menstruation. If you are experiencing unexplained mood swings, it is beneficial to consult a healthcare provider to assess your vitamin B12 levels and other potential causes. Addressing any deficiencies and underlying issues can help improve mood stability and overall well-being. Now that we've explored the signs of vitamin B12 deficiency, let's focus on how you can enhance your vitamin B12 levels through your diet. Incorporating specific foods rich in this essential nutrient can help maintain adequate levels and support overall health. Animal liver and kidneys. Animal liver, particularly from lamb or beef, is an exceptionally rich source of vitamin B12. A small portion, such as a 3-ounce serving, can provide more than the daily recommended intake of B12. Liver is not only nutrient-dense but also packed with other essential vitamins and minerals. It helps support red blood cell production and nervous system function. If you're not fond of liver, consider integrating it into dishes like pâté or stews. Kidneys are also a great source, offering similar benefits and can be included in various traditional recipes. Fish and seafood. Fish and seafood are excellent sources of vitamin B12. Clams, sardines, and mackerel are particularly high in this nutrient. For instance, a 3-ounce serving of clams provides over 1,000% of the daily value of vitamin B12. Sardines and mackerel are also beneficial, delivering substantial amounts of B12 along with omega-3 fatty acids, which support heart health. Regular consumption of these seafood options can help maintain adequate B12 levels and support overall health. Opt for wild-caught varieties when possible to maximize nutritional benefits and avoid contaminants. Meat. Various types of meat, including beef, pork, and poultry, are good sources of vitamin B12. A 3-ounce serving of cooked beef offers about 40% of the daily recommended intake. Chicken is also rich in B12, providing a substantial amount with each serving. Incorporating these meats into your diet can help ensure you receive enough B12 to support red blood cell production and nervous system health. Choose lean cuts to balance your intake of B12 with other important nutrients while maintaining a healthy diet. Dairy products. Dairy products like milk, cheese, and yogurt are significant sources of vitamin B12. A cup of milk or a serving of yogurt provides a good portion of the daily recommended intake. Cheese, especially varieties like Swiss and mozzarella, is also rich in B12. These dairy products not only contribute to your B12 levels but also offer other essential nutrients like calcium and protein. Including dairy in your diet can help support bone health, muscle function, and overall nutrition. For those with lactose intolerance, consider lactose-free or fortified dairy alternatives. Eggs. Eggs, particularly the yolks, are a valuable source of vitamin B12. A large egg contains approximately 6 micrograms of B12, contributing significantly to the daily recommended intake. Eggs are versatile and can be prepared in various ways: boiled, scrambled, or poached, making them a convenient addition to your diet. They also provide high-quality protein and other essential nutrients, including vitamin D and choline. Incorporating eggs into your meals can help boost B12 levels and support overall health. For those with dietary restrictions, consider B12 fortified egg substitutes. Fortified foods. For individuals following a vegan or vegetarian diet, fortified foods are a crucial source of vitamin B12. Many plant-based milks, such as soy, almond, or oat, are fortified with B12, as are certain breakfast cereals and nutritional yeast. These fortified options help ensure adequate intake of B12, which is not naturally found in plant foods. Nutritional yeast, in particular, can add a cheesy flavor to dishes and is often fortified with B12. Choosing fortified products can help prevent deficiency and support overall health in plant-based diets. Fortified nutritional yeast. Fortified nutritional yeast is a popular option for adding vitamin B12 to a vegan or vegetarian diet. This yeast, often used as a cheese substitute, is typically enriched with B12 and offers a savory, cheesy flavor to dishes. 1 tablespoon of fortified nutritional yeast can provide a significant portion of the daily B12 requirement. It is versatile and can be sprinkled on popcorn, pasta, salads, and more. Besides B12, it also contains protein and fiber. This ingredient is a valuable addition for those looking to enhance their nutritional intake without animal products. By incorporating these vitamin B12-rich foods into your diet, you can effectively boost your levels and support your overall health. If you suspect a deficiency or have dietary restrictions that limit your B12 intake, consulting with a healthcare provider for tailored advice and potential supplementation is advisable. If you found this video helpful, be sure to like and subscribe for more content on health and nutrition. Don't forget to hit the notification bell so you never miss an update. If you have any questions or want to share your own tips for boosting vitamin B12 levels, leave a comment below. Your feedback and engagement help us create more valuable content tailored to your needs. Thanks for watching, and see you in the next video.